Hello, I'm Dr. Leeds of drleeds.com and also therehab.com, and I'd like to review with you this new database being put together by needymeds.org. It's www.needymeds.org/substance-addiction, and you see Needy Meds find help with the cost of medicine. They also help with medical services like doctor visits. So you can see here, free, low-cost, sliding scale substance addiction clinics. The clinics in this database offer mental health services. Some may also offer dental, medical, and mental health services, and are free, low cost with a sliding scale based on income, or offer some type of financial assistance. If you are under or uninsured and looking for a nearby free clinic, sliding scale clinic, or low-cost clinic where you and or your family can go for lost cost medical care, Needy Meds can help. Please note that the clinics listed are not necessarily free. So that's an important thing to note, but at least they should be low cost, or they should be willing to work with you. For additional information and appointments, contact the clinic directly. For a description of which clinics we include on our website and what type of information we provide on each clinic, visit our free low-cost sliding scale clinics page. So anyway, they give you a variety of ways to find free clinics, and let's see, you can choose your state. I'm going to choose the first one on the list, Alabama, because it's easy. It's alphabetically first. Also, I have had people from Alabama reach out to me looking for low-cost addiction treatment, and so this would be a good source of information. This would be a good place to refer people to look. So you can see the first couple are HIV/AIDS clinics, but they also do offer substance abuse and addiction treatment. I don't definitely see MAT, or medication-assisted treatment. So if somebody's looking for a low-cost or free Suboxone type program, I don't know that these will definitely have that. So that might be interesting to look for. So let's go back, and okay, they don't really allow you to, as far as I can tell, search by keywords in the description. That would probably be useful. So I don't know what else to do there. Okay, let's try another area. Let's try Iowa. And it goes right to the state. Okay, now here maybe I'm not looking in the right place. I don't even see anything about addiction. I don't necessarily see anything about addiction treatment here. So that's also significant because, let me see if I can search the page. Okay, so there's 24 matches on the page. So okay, there's substance abuse addiction. That was pretty far down on the page. I would think that every one of these would include it. But that's something you can do. You can, in your web browser, you can search the page for a keyword and, addiction, substance abuse. What if we look for MAT? Not found. What about buprenorphine? Nothing with even BUP is found. Suboxone. What's a substance? Okay. Nothing matching SUBO, which would be the first four letters of Suboxone. Let's try medication. Okay, that one offers free prescription medication. Only 2 out of this entire page for the state of Iowa mention, okay, here, medication management. Okay, but that doesn't necessarily imply MAT or medication-assisted treatment for opioid addiction. Okay, so clearly I believe they're still working on this database. So we might want to reach out to them and recommend possibly a search for more fields other than just the address, and also including whether a program offers MAT or not, because currently that's the crisis that we're in this country, is the opioid epidemic, and the solution is to provide medication-assisted treatment to as many people as possible. So, but this is a start. At least you can find places that provide addiction treatment, and I would assume that many of these programs should offer MAT because that's what works, and that should be part of addiction treatment. Okay, so thank you for watching. I'm just going to go back to the page we started at. Okay, that was for Alabama. So yeah, free low-cost sliding scale medical clinics. Oh, were we on the addiction? Let me just... We were before. Okay. Yeah, originally, so somehow along the way, it looks like I got off of the substance abuse. Let me try that again for Iowa. Let me just be fair to try one more time. Okay, so here, see, I somehow got off of the page of substance addiction clinics, and now every single one does have substance abuse and addiction listed. Okay, so it was my mistake. So still, it would be nice to be able to search the other fields besides the address, but it looks like when you start in the right place, you do get all the proper results. Let's again search now for MAT, not found. Buprenorphine, no. Suboxone, no. Okay, so that would be relevant. Another interesting thing you might do is search another site like okay, 1 second. I don't know why the internet is so slow now. I'm messing up my video. SAMHSA. Maybe I should pause. This is crazy. Okay, so we were here on EDMed's substance addiction clinics list for Iowa, and just for example, let's look at the first one. The zip code is 50606, Arlington, Iowa, Covenant Clinic, Arlington. So we don't know if they provide Suboxone or MAT treatment. So let's go over here, buprenorphine treatment practitioner locator. Let me jump back. 50606, copy that. This might be a way that we can figure this out on our own. Okay. And we're waiting for it to load. I'm sorry, I've got a bit of a slow internet connection. Okay, here we go. No result found. So SAMHSA, who is the government organization in charge of the buprenorphine program to treat opioid addiction, they do not list any doctors in that 50606 zip code from Arlington, Iowa. So clearly there's a need there. Let's try Cedar Rapids, Iowa. Put that zip code in, apply, and wait for the internet. Come on, come on. Okay, hopefully they're going to have somebody who can help. Now over here, yeah, so we know that Cedar Rapids okay, this is a VA community-based outpatient clinic. So already this may be limited to veterans. I'm not sure if that's what VA means there. Okay, so it's loaded. Okay, we did get, okay, here, you see it lists individual doctors. I don't know, that makes it a little more difficult. Okay, so it's 2230 Wiley Boulevard. Anyone listed at that address? Well, this is pretty much everybody for Cedar Rapids. That's all the doctors that do that are listed, but probably this is all of them because, you know, when you go through the training and you get certified, that this is the organization that would have your information and list you. So Cedar Rapids doesn't have a lot, and none of them are at that address. So I couldn't tell you definitely that this particular clinic provides MAT with buprenorphine. Let's try Des Moines. Des Moines, Iowa, largest city in Iowa. 50316. See if we can find any free buprenorphine treatment, MAT, in Des Moines. It's where I went to school, for medical school. Des Moines University. Okay, so we're waiting for the internet again. Okay, here we go. So, okay, here they list some clinics. So, you know, being the biggest city in Iowa. Let's go back over here. Maple Street Baptist Church Free Clinic. Okay, surprisingly, Des Moines, Iowa, Des Moines, the biggest city in the state of Iowa, does not have a huge list of doctors. I mean, if I mean, at least in that zip code, I guess there's, you know, that I guess that's true. I'm looking in one zip code, but Maple Street, that's 1552 Maple Street. Let's search the page, 1552. No, they're not even listed, unless there's a doctor that works there who doesn't have their practice address there. So it makes it more complicated. You would actually probably want to go through this list and make some phone calls. They do list their phone numbers. So that doesn't really help to try to, you know, I thought maybe we could cross-reference two different databases between SAMHSA and Needy Meds and figure out, do they provide MAT? All right, so at least you have the phone numbers here. You can make some phone calls. You can find the places in your area that provide free or low-cost addiction treatment and, you know, go from there. So I hope that this helps. At least it's a start. We can hopefully reach out to Needy Meds and let them know that it's important that we know if these places provide MAT or not. Okay, thank you very much for watching, and I greatly appreciate it. And if this video has been helpful to you, I would definitely appreciate it if you give it a thumbs up and subscribe to the channel. Thank you.